Good afternoon, everybody. I am Patrick Rosenthal with Texair Filters. I am the Central Texas Regional Manager, and I'm glad that we all could get together and discuss a new published guideline from NAFA. This presentation is going to be on the best practices and guidelines webinar for the filtration for continuing care retirement communities. It was a guideline we published in 2022 as a part of the NAFA Guidelines Committee. I am the lead author, and I'm glad to be able to do a little bit more of a deep dive with you all on this document. So let's go ahead and get started. Okay, NAFA, the National Air Filtration Association, is an association for air filtration professionals. We specialize in filtration expertise, education, best practices, and it's been a very dynamic, helpful organization for our filter company and everyone that we've been gotten involved with, or gotten anyone in the facility maintenance industry involved with NAFA has been very grateful that we've done so. Okay, on April 12th through the 14th, we have our technical seminar in Atlanta, Georgia. If you have not signed up yet for this technical seminar, I highly recommend it. We've got some great speakers lined up, great social activities. It's a great place to get certified if you have not gotten a CAFS designation. This is a great opportunity to do that. So again, if you have not signed up for this technical seminar, I'm really looking forward to it. I'm actually go back to this one. I'm actually chairing the seminar. So if you're here today and you're going to the seminar, you'll see more of me, as I will also be the MC for our technical conference. Okay, before we get started, I wanted to mention the NAFA podcast. Tony, who's on this call with us, is the person who has recorded and produced, I think it's like 5 or 6 episodes now. It's really excellent. If you have not listened to this, I highly recommend it. This is one kind of piece of our new marketing campaign for NAFA to try to reach people in a different way that we haven't reached them before. And if you have not listened to this NAFA podcast, I highly recommend it. It's on all the major streaming services. It's got a QR code right there in the top that you can use to listen and subscribe. Here's all of our social, Facebook, Twitter. Again, NAFA and Tony and the whole staff's working very hard to get the word out there about best practices in air filtration. Okay, here's a little bit of information as to what's going on the NAFA Guidelines Committee. I don't know if any of you have participated in the Guidelines Committee in the past, but 2022 was a big year for us, and we had a lot of changes as far as how we create the guidelines, the process itself. We hired a technical writer that has been helping us with a lot of the technical writing. We've got a lot of people who are experts in air filtration, but maybe not always experts in professional writing. So the way that the documents look, the way that they feel, they flow, all those things, we're getting a lot of help. So if you are interested in participating in the Guidelines Committee, it's really an exciting time to be on that committee. We're getting a lot done. We are basically tasked with creating 2 new guidelines every year. We're along with 2 revisions or some combination thereof. So we could do 3 new guidelines and 1 revision per year, or we could do 4 new guidelines in a year. Either way, we really need to do, as a part of the strategic plan for NAFA, we need to do 2 new and 2 revisions, some combination of those. In 2022, we published 3 new guidelines. One was filtration for indoor cannabis growing, continuing care retirement communities, which is the one we're going to go over today. and then residential HVAC for technicians and contractors. We have these guidelines on the NAFA website. They're free to download. Please download and distribute them. We also published a revision of the higher education guideline, which was originally published in 2014. Okay, again, we have a new guidelines approval process. It has really helped us to streamline, our process in getting guidelines approved and published. We have a paid technical writer. We're working with the committees to streamline that process. Basically, if you're on the committee for technical or committee for guidelines, you not only have to make a suggestion, but also give us some writing help as well if you're going to make that suggestion. And that's actually reduced the amount of corrections that we've gotten through that process. So people realize, hey, if I'm going to go in and make a comment about this, I really need to be educated, and I need to give them some guidance as well as just making the comment. So the guidelines committee has moved is moving very quickly through publishing these guidelines now. All of our guidelines are working documents. They're always open to suggestions, comments, edits, and improvements. And we're always looking for NAFA volunteers to team up with our experts on any topic that you are familiar with: hospitality, hospitals, welding fumes, filter testing, and so on. These are just a few that we're looking at creating new guidelines for in the future. NAFA guidelines are designed to meet best practices for filtration in facilities. We aim to go beyond the bare minimum and provide advice on achieving the cleanest air possible based on the designs and limits of the existing HVAC equipment. So we are not a standard writing group. That's not what NAFA is, organization, but we have a lot of expertise, and we, as a part of this guideline and many other things we do, are really about best practices. So again, we're going beyond the minimum. Okay, so getting a little more specific about the guideline today, the modern retirement community. The popularity of continuing care retirement communities with social activities, restaurants, classes, and other privileges has risen significantly in the last 30 years. Improving environmental controls such as indoor air quality through air filtration can lead to great benefits for the residents, staff, and visitors of the modern retirement community. Here's a couple pictures here of some retirement community. This was from Senior Housing News, and you can look at the facilities. They're really something else. There's a lot of really incredible facilities out there for retirement. Okay. One way that these facilities can separate themselves from the rest of their market is to get a clean air award. Make your retirement facility an industry leader with an indoor air quality by obtaining a clean air award from NAFA. On the right here, you can see an article that was published by the Texas Facilities Commission in Austin, Texas, where I'm from. We had a little presentation on one of the parking garages where, a lot of the top people in TFC came together. They had people taking photographs, and they have an internal magazine or kind of newsletter that goes out, and they were able to write about how they had achieved this clean air award, which, if you can look at the picture, everyone in the picture is wearing masks, and this kind of came in right at I think the first year of COVID. So, if you're really talking about trying to, improve how people view you as a leader and maintaining your facility, the Clean Air Award is just a fantastic way to do that. Upgrading your air filters is a reasonably low cost way to show your tenants and your staff that you're serious about maintaining the facility at a high level. Many points given out for the Clean Air Award are upgrades that your facility is probably already doing. So it's sometimes not even that difficult to make the upgrades, because you can get points for things for your retirement facility that you're already doing. Any certified air filtration specialist, CAFS from NAFA, will be able to lead you in the right direction as to how to get that clean air award for your facility. So I highly recommend reach out to that are your customers, as well as, if you are a retirement community facility manager, reaching out to a CAFS and getting some more information on the Clean Air Award. This is the form right here on the Clean Air Award. And like I was saying before, some of these categories, these are things that you're already doing in a lot of cases. So sometimes you're, halfway there or more. And for a couple of examples, turning in a record of the filter change schedule that you're already doing, how often you change the filters, the sizes, and so on, that can get you 10 points. You can also receive points based on the MERV efficiency of your filters. So like a MERV 8, you can get 8 points, MERV 13, you can get 13 points. If you had your coils clean within the last 2 years, that's 6 points. And then some categories are a little more involved. Installing filter monitoring devices, magnet helix on some of your units, using gaskets on the filter housing. Both of those are 10 points. Installing UV lights, that's 10 points. And then if you get all your points up to 52, your facility will be awarded the Clean Air Award, which comes with a little glass trophy and a certificate. And it's a really great thing to do for indoor air quality for your facility. Okay, why is clean air so important for retirement facilities? Residents in retirement facilities spend about 85 to 90% of their time indoors. The elderly are more vulnerable to air polluting substances because of the body's inability to cope with harmful pollutants as they age. Many residents have inflammatory disorders such as allergies and asthma. Indoor particles below 2.5 microns in size can be significant contributors to chronic diseases such as heart disease, bronchitis, and higher rates of mortality. Due to additional challenges presented by COVID-19, RSV, and the flu, we know that air quality and infection control are just as important as it would be in many areas of a hospital. Okay, the continuing care retirement community model. So the actual name of the guideline is the Continuing Care Retirement Facility Guideline. And a continuing care retirement facility is it's basically a staged process where you have several stages in the retirement community. The first one is independent living. The second one is assisted living. Many of these communities have been adding memory care for things like Alzheimer's. And then you have a skilled nursing facility, and it's actually different facilities within the retirement community. So we have different filtration recommendations for each area. And if you have a retirement home that only focuses on that one area, you can just focus on that one area of the guideline and see what the filtration recommendations are. Okay, so here we go. Independent living. Independent living communities are for highly independent seniors. Residents live in private apartments or homes with increased security, transportation services, and recreational activities. Installing a MERV 13 filter in the independent living quarters is recommended. MERV 13 filters will remove greater than 90% of all particles in the 3 to 10 micron range. Independent living apartments will have split systems, allowing for easy upgrades to MERV 13 filters. For residents who have pulmonary issues such as allergies and asthma, using a standalone air purifier with a HEPA filter and molecular filtration can be an effective air quality control. HEPA filters remove 99.97% of particles down to 0.3 microns in size. Molecular filtration will remove harmful volatile organic compounds and odors. Be sure to provide units that use a true HEPA filter, molecular filtration, and a strong enough motor to get at least 6 air changes per hour. Stay away from air purifiers that use ionization, which create high levels of ozone as a byproduct. Ozone is a known lung irritant and can make the situation worse for residents. So it's very important to do your due diligence when you're doing standalone air filtration in any part of the retirement facility or any facility. There's a lot of air cleaners that are out there, and doing your research and figuring out what's effective and safe is very important, but it can be an effective way to deal with air quality, particularly because, you plug them into the wall. You don't have to do any HVAC system upgrades. They're very versatile. Okay, here's a picture of a MERV 13 filter. It has low pressure drop, an increased number of pleats to increase the surface area of the media, fits into the existing housing with no retrofit. So it's a very easy upgrade going from a MERV 8, from a MERV 10 to a MERV 13 or higher. It is a easy switch. If, you have systems that already have housings that are designed to keep in your filter, you can put a MERV 13 filter and they're just the same. Since COVID-19, most filter suppliers have MERV 13 readily available. That was a big issue at the beginning of COVID, and it is getting better. It's certainly something that if they do not have in stock, then they should have pretty readily available for their customers. MERV 13 qualifies for LEED points in the U.S. Green Building Council program. Okay. This is an example of a standalone air purifier. Again, there are a lot of air purifiers on the market. This particular brand is one that I like, but it is not the only brand that is a good air purifier. So don't look at that. Just let's go over a couple of points here that you really want to look into when you're getting a standalone air purifier. HEPA filters remove 99.97% of particles down to 0.3 microns in size. It includes allergens, bacteria, and viruses. Molecular filtration will remove harmful volatile organic compounds and odors. You want to have a strong enough motor to get at least 6 air changes per hour in the square footage of the room. So make sure you know what the square footage of the room is, and you know what the air purifier is rated for that space. Again, stay away from air purifiers which use ionization that can create high levels of ozone as a byproduct. Ozone is a known lung irritant and can make the situation worse for residents, particularly when you're using things like cleaning supplies that can interact with the ozone and create a lot of ultrafine particles. It's not a good idea. So be very careful when purchasing these units. This is a good example again, but there's a lot of CAFSs out there that are in NAFA that can guide you to an effective air clean. Okay, assisted living, the next stage. Once the resident moves from independent living to assisted living, there's a greater need for indoor air quality controls. Residents in assisted living might have their immune system compromised as they age. Allergies and asthma can turn into chronic obstructive pulmonary disease, COPD. Filtration can be an important component of managing the air quality for patients with COPD. Other pulmonary diseases, such as emphysema, can be very challenging to patients and the staff. The HVAC systems in assisted living facilities should be upgraded to MERV 14 filtration, which removes 90% of the particles in the 1 to 3 micron range. So much smaller than 3 to 10, 90%, 1 to 3 micron in range. Standalone HEPA air purifiers can also be used. In-room air filtration is a great way to supplement the air filtration in this area. And molecular filtration can be used for the removal of odors and volatile organic compounds. Okay, here is an example of a MERV 14 MINIPLEAT. The HVAC systems in assisted living facilities should be upgraded to MERV 14 filtration, which removes 90% of particles in the 1 to 3 micron range. They have a low pressure drop. They can be used in existing housing, but be careful of the increase in pressure drop. So basically, there are MERV 14 filters that have lower pressure drop. I've seen some on the market that are really great. The way you can tell is you can ask your supplier for a third-party test report. But again, MERV 14 filter is going to be picking up a lot more particles. It's a much more efficient filter. So you have to be aware that, over time, the pressure drop is going to go up. So you need to be aware of those constraints on your HVAC system and make sure that that's in line with where it needs to be. and they can also last longer if they are pre-filtered. So as you can see through the construction of the filter, that's a lot of media. You know, it may be one of these things where you want to get a pre-filter that you can change more regularly and save the life of the final filter for less changes. Okay, skilled nursing. Skilled nursing facilities consist of minimally furnished rooms with a bathroom, hospital beds, and 24-hour medical staff. Residents in these areas are almost completely immobile, either recovering from a short-term illness or injury or being treated for a chronic illness. It is important that these residents are made as comfortable as possible, since they're in these rooms almost 24 hours a day. Infection control is just as important in these areas as it would be in many areas of a hospital. MERV 14 filtration and the HVAC systems will remove 90% of the particles in the 1 to 3 micron range. Molecular filtration can remove many odors or gaseous contaminants that may be found in skilled nursing facilities. However, it is important to note that source control is always the first recommendation when it comes to odors or gaseous contaminants. Source control will always be the primary step in trying to remove those things. Okay, here is another picture of this is a MERV 14 MINIPLEAT V cell. And this is also a really efficient filter. It's got a lot of media in it. It not only has the media from the MINIPLEAT, but it also has the media. The V's themselves are made of MINIPLEAT media. So there's a much longer life on these. They're very efficient. A lot of them do have a lower pressure drop. They use certain medias that give you ability to have a lower pressure drop. They can be used in the existing housing, but be careful of the increase in pressure drop. So you can put them in a current system, but you have to be careful again that your system is running efficiently with the filter in it. And the V-cell configuration doesn't fit into the housing without any retrofit. It will, many times you'll have the space to put in the 12-inch filter behind the pre-filter, which would become the pre-filter if you put in the final. But you have to add a track if the track doesn't already exist and it wasn't made during construction or you know, the actual you know, construction of the unit originally. You've got to get a track in there that will fit in it's a 1-inch sliding housing or header. So there is some retrofit with a V-cell that you need to consider. And again, always ask your supplier for a third-party test report. When it comes to third-party test reports, the best thing about that, having that on file for whatever filters you're using, is that if you do want to compare it to other filters, there's a lot of interesting information, useful information on the third-party test report that will allow you to compare your filters to other filters on the market and have kind of an idea of how to, as best as possible, to have an apples to apples comparison. Okay, here is a section on the ASHRAE filter recommendations for COVID-19. And ASHRAE, the American Society of Heating, Refrigerating, and Air Conditioning Engineers, recommends mechanical filter efficiency be at least MERV 13 and preferably MERV 14 or better to help mitigate the transmission of infectious aerosols. Many existing HVAC systems were designed and installed to operate using MERV 6 or MERV 8, while MERV 13 and greater filters are better at removing particles in the 0.3 micron to 1 micron diameter in size, the size of many virus particles. The higher efficiency does not come without penalty. Higher efficiency filters require greater air pressures to drive or force the air through the filter. Care must be taken when increasing the filter efficiency in an HVAC system to verify that the capacity of the HVAC system is sufficient to accommodate the better filters without adversely affecting the system's ability to maintain the owner's required indoor temperature and humidity conditions and space pressure relationships. And that's from the ASHRAE Epidemic Task Force in Building Readiness, published in April of 2020. So that's really indoor air quality is becoming a much more important concern for a lot of facilities managers. Like I was saying before, it's not just COVID. There's the flu, there's RSV, there's allergies. There's the potential of very small particles to be contributors to other diseases. So it's been, kind of in this really great place for people to start focusing and talking about indoor air quality. And the higher efficiency filters, when you start to get into MERV 13, 14 and greater, those do require you to also look at the capacity of your HVAC system and make sure that that is enough to maintain the required temperature and humidity conditions. So, the one of the best things that I've found about the MERV 13 is a lot, just from personal experience, a lot of the upgrades that we've done, there has not been near as many problems as they initially thought there was going to be from going from MERV 10 to a MERV 13. And that's been great because our customers have been able to address a lot of indoor air quality concerns, and the results are that their systems are still working efficiently. But it is something that you need to be concerned about. And again, talking to a CAFS, a certified air filtration specialist, they will be able to help you with a greater understanding of how to make sure you get both the indoor air quality improvements and the efficient use of your HVAC system. Okay, back to the guideline here. And every guideline that has come out, we have actually created a COVID-19 special section. And you can see on the right side, just the way the guideline looks. It's much more professional, looks much more like a textbook. Using our technical writer to help us with this has been really incredible. So in each document, we keep something in there for the COVID-19 special section. And we've looked at doing other things as well. Things like smoke from wildfires and such, having some kind of guide inside the guideline that people can follow. And then at the end of each guideline, there's an installation, operation, and maintenance section. And what that does is that helps for the end user of a retirement facility or any other facility to really make sure they're getting the most out of their filters, that they're actually getting the efficiency that they're using, that they're properly changing the filters on time, that they understand that their HVAC system does need some, inspection. So like, for example, that we recommend that a NAFA certified air filtration specialist inspects the system integrity every year. And I think that'd be, if you're an air filtration professional and you're on the call right now, I would definitely recommend including in all your proposals a line item that says, will include annual inspection of system integrity, and make sure the customer understands that if they want you to come out and look at their system and make sure that it's working properly, that you'd be very willing to do that. And that's a big value add to have that kind of resource from your filter provider. Okay, education and training. You can also train your own staff of the retirement facility to get something called a NAFA certified technician, NCT designation. And essentially what that is, it's an open book test. Your on-site personnel can get the certification, and it just shows that they are a professional when it comes to maintaining air filtration systems. And again, it's about going above and beyond the minimum and make sure that you're showing people how much you care about air quality and the quality of your facility. Okay, this is the continuation of that section. And then, there's a couple of pieces of information like on filter disposal, for example, particulate filters should be disposed of in a careful and safe manner. All spent filters removed from the air handling unit should be placed in a plastic bag or filter box, sealed immediately and removed from the area for disposal. So there's a lot of helpful tips like this on the installation, operation, and maintenance section about how to change the filters and then put them back in a box or a bag and seal them as you're bringing them back through the facility after they've been changed, and not spending all this time putting getting the filter itself to pick up all this particulate, and then you just set it on top of the cart on the way out, and it just puts everything back in the air. So there's a lot of really helpful information in these guidelines now as it regards to installation, operation, and maintenance. Okay, so PPE, there's a lot of PPE that people who change filters can use for best practices. Goggles, hard hats, coveralls, gloves, these are all things that that improve safety. Make sure that they're weather appropriate. We've had this discussion before in the committee, and if you're wearing coveralls, steel-toed boots, a hard hat, gloves in the middle of summer in Texas, you're probably going to be a lot less safe than if you were wearing weather appropriate equipment. So it is very important to consider your environment and what you're asking people to do to maintain safety. So PPE is very important, but it's also just important to make sure that it is weather appropriate and safe. Okay, is your filter system working at optimal performance? Is the filter bank rigid and capable of supporting the filters? So is the filter housing in good shape? Are the frame channels clean? Are there gaskets and sealing mechanisms that are intact and functioning? Are the right type of quantity of fasteners installed and working correctly? Check all filters, especially secondary filters, for wear and damage. Replace as required. Are all potential leaks between the plenum and the frame sealed? So this goes back to what we were talking about before with the efficiency of the filter. You want to make sure that your MERV 10 is getting MERV 10 efficiency, that your MERV 13 is getting MERV 13 efficiency. And if there are gaps in between the filters themselves or the filters in the housing, you're going to get air bypass, and that's going to result in some loss of efficiency of your filters. Plus, the air that's getting around the filter is going to be dirty air getting into the coils, getting into the rest of the HVAC system. So it's just very important that you understand how to maintain your filter system integrity. Here's a couple of examples. I actually took these slides from Kevin Delahunt, who is the chair of the Guidelines Committee, for his presentation on commercial offices. But there were some good slides in there about maintaining system efficiency, the filter integrity. Here's one right here that shows a filter that does not have a door on the outside of the housing and one that does have a door. So you want to make sure that all your doors are replaced properly and in place when you do the filter changes. No door, no seal. Okay, here is an example of someone that has used a gasket on the outside of the filter. And we talked about the gasketing a little earlier when we were talking about the clean air ward. And that's a way to really get a good seal on your filter is to use a gasket. However, in this case, the gasket does not, even with the gasket, it does not go to the end of the opening to filter the air. So you're not even getting close to the efficiency that you could if you've got gaps like this. Here's a picture of another gap. And this is interesting. This is these are basically dirt trails on the housing door. And if you open your air filter housing and there's these zigzag lines, essentially that means that the air is getting to the outside of the filter. And so you have to be, really careful, making sure that that gasket is sealed all the way. Spacers, incredibly important when it comes to maintaining system efficiency and integrity. You want to make sure that there are no gaps, and spacers are very inexpensive ways to do that. Also, if you have, custom size, you maybe don't have to use a custom size in a filter housing if you can get a spacer that's going to be on the end of that filter, and that maybe could save you some money as well. We have a sheet metal shop that we work with that makes these spacers for us, and they're literally $5 or $6 each. They're very inexpensive. So using spacers properly is also a very important part of maintaining system integrity. Okay, this is another piece of the guidelines that we have updated. Previously, this copyright and usage section was very different. It was like basically saying, this is our proprietary information. Do not share this. Do not make sure that you have to give NAFA the credit. You know, the information is ours. Don't use it in these particular situations. A lot of legal speak. And we decided that the point of the guidelines is to make sure that people get the information. So they should be doing the exact opposite, which is sharing the information. So now our copyright and usage section says we strongly encourage the use and dissemination of this information. You can print it, you can download it for free on NAFA's website, you can put a link to it on your website, you can email it. Please use and disseminate this information as often as you would like. I mean, obviously, we don't want somebody trying to charge for NAFA's information, but you know, as far as getting the information out there, best practices, indoor air quality, you know, these are things that we really want people to be engaged with. And if we don't encourage the dissemination of information, then that could hinder that. So we changed this section totally, and it is now encouraging sharing the information. Okay, that is what I've got for the slideshow, and I've got my information on here, my company, email, cell phone, and if there is any, we've got some questions that people have sent in beforehand, and I'll address those. You may have some time for some additional questions for people who have used the chat feature. But if you have any questions regarding this guideline, any information about guidelines committee or NAFA or anything in general, please feel free to reach out to me. And I know that Jim Moran is on the line, and he can help me with this next part.
Absolutely. Thanks, Patrick. There's a lot of great information in there. Really appreciate you taking the time and doing this today. And yeah, I got a list of questions up here, and we have a few that came in as well. So we'll get right into them. Starting with one here, have there ever been any legal ramifications caused by negligence in regards to air filtration application and or maintenance?
It's possible that there could have been some legal ramifications at some point. I am not aware of any previous lawsuits for anything regarding filtration application or maintenance. It doesn't mean there could be in the future, maybe with a little bit more of the concentration on indoor air quality. Maybe there could be something like that, but I haven't heard anything if there is.
Perfect. Thank you. What is the most serious air quality concern facility managers have in senior living communities?
In senior living facilities, really the two main concerns are ventilation and air filtration. They basically, like in a retirement facility, you're really trying to maintain the highest air quality that you can. And they need more fresh air, they need more ventilation. They need at least 6 air changes per hour through the filters in their HVAC system. And there's a lot of good recommendations out there from ASHRAE. I would definitely say that they need more ventilation, more fresh air, better filters, and they need to put the air through the filters more often. Probably most facilities are at 2 to 3 air changes per hour of air through the filters, and they need to be more at something like 6.
Excellent. Are you recommending minimum MERV 14 air filtration in areas where there might be open wounds being treated?
Okay, that's that question. You know, as it regards to open wounds, I don't really understand that fully. But what I would say is that a lot of these facilities do not do advanced procedures that a hospital would do. They work very closely with, you know, some hospital system that's close to the facility. And if there is a surgery or procedure that needs to be done, then they transfer the resident over to that hospital for that procedure. But if there is part of the facility, particularly in skilled nursing, where they are doing medical procedures, that would be something that a hospital would do, then they need to be following the same standards for air filtration that a hospital would.
Perfect. Thank you. How does in-room filtration affect the filtration plan? And then also, what is your take on the coming ASHRAE pathogen mitigation standard?
Okay, this is a great question. And in-room filtration, I think, will always be a part of the filtration plan. It's just such a easy way to advance the indoor air quality in any space. You can target it. Like I was saying earlier in the presentation, if you have somebody that has allergies or asthma, using a HEPA filter in that room is great. I mean, you're getting 6 air changes per hour of air through a HEPA filter. And you can do that without any upgrade to the HVAC system. Again, it's got to be a high quality air cleaner. You got to do your due diligence. There's a lot of air cleaners on the market that make a lot of claims, and you have to be very careful about what you use. But overall, I think in-room filtration is certainly going to be a part of any future plan. And as far as the ASHRAE pathogen mitigation standard, I think there's going to be some really good stuff that comes from this. There's a lot of really great people that are working on this. I know Bill Bonfleff is working on this. He spoke at NAFA a couple of years ago. And I think it's something that, we'll be able to get behind when the time comes.
Excellent. Thank you very much. This one I believe you just answered, but just kind of going down the list here. How many cycles of fresh air per hour should a typical facility be using? Is that 6? Is that what you're most comfortable with there? Or did you want to elaborate on that anymore?
Yeah, I think at least 6. I think most facilities are probably at 2 to 3 air changes per hour. And if they can get up to 6 or greater, then that's wonderful.
Okay. Going here, we'll jump back to the beginning of the list there. I'll just pulling some out. I think we got about 4 or 5 more questions here we'll go over. And then, as Patrick said, anybody who has any additional questions we didn't get to are coming through, please feel free to reach out to him and he's more than happy to help. Looking here, what would you recommend? What would you recommend looking into when comparing MERV 8 versus MERV 13 filters? Is there any additional guidance available?
I mean, right now, I think what?
I know it's a little bit of a loaded question there, but just kind of
it's a little, but that's okay. I think right now, with the situation we're in with COVID, RSV, the flu, again, issues with small particles that we're finding out how they contribute to the development of certain diseases. Just, I guess, the importance of indoor air quality in general. I just think if you can get the best air quality in your facility, you should, and that would be MERV 13, compared to a MERV 8. I mean, you want to try to work your systems up to getting that efficiency through the HVAC system. Now, it's only a part, filtration is only a part of the indoor air quality program. I mean, there's other things that you can do, but certainly, as far as MERV 8 versus MERV 13, I think going with what ASHRAE currently recommends and going with the 13 is going to be 13 or greater is going to be better.
Perfect. What kind of filters are typically needed or used in residence rooms and common areas? And, with you writing the guidelines for this and being heavily involved with that, and I'm sure you have a lot of customers that are out there, just kind of going over what are you typically seeing in the field and what are you recommending versus the rooms versus the common areas?
I mean, it varies. I mean, it varies between facility as far as what they're using, but I would definitely recommend going with the MERV 13 for independent living. I think using it in the living quarters is an easy change. It's an easy upgrade. As far as upgrades to your facility and costs go, I think, going from a MERV 810 to a MERV 13 is very reasonable. So I'd say MERV 13 filters in the living quarters.
Excellent. We'll have one more question here, and I think that'll get us about the 45-minute mark. In this one, if you want to elaborate on as much as possible, how can we know if our HVAC ventilation system is adequate according to the type of filters required for retirement communities?
Okay, this is a really good question too, and I think there's a lot of some interesting things that are going to be happening in this area in the upcoming years. And basically it's going to be revolving around particle counters and, particles counters that can measure CO2, that can measure VOCs, particles of different sizes, ones that are particle counters that are somewhat affordable. So I would say that, there are definitely ways to measure these things. It's just that the technology has to catch up to, what we're doing with filters. We need these particle counters installed. And I believe that once they are, that there will be measurable differences in air quality. There will be a way to show that. And I'm interested to see what's going to come out in the next couple of years.
Awesome. Well, Patrick, thank you again very much for all the information here. Thank you for taking some time to answer some questions, and thank you for providing your contact information if anybody has any further questions. And thank you to everybody who joined today. We really appreciate it, and we look forward to you getting on the next one as well.